While not all birth defects can be prevented, there are several steps that can significantly reduce risks. Avoiding alcohol, smoking, illegal drugs, and unnecessary drugs, as well as taking essential vitamins, can help avoid many risks. In Orthodox Jewish communities, the organization Dor Yeshorim runs an anonymous screening program to help couples avoid conceiving a child with Tay Sachs or other genetic disorders. Orthodox Jewish high school students are given blood tests to check for the Tay Sachs gene. Instead of receiving direct results, each person gets a 6-digit identification number. Couples can call a hotline, and if both are carriers, they are deemed incompatible. This way, individuals are not directly informed of the carrier status, which helps prevent stigmatization or discrimination. If this information were made public, carriers might become unmanageable within the community. Anonymous testing helps eliminate the stigma of being a carrier, while reducing the rate of genetic disorders in the population. This approach has proven very successful, as the incidence of Tay Sachs disease among Jews has fallen by more than 90% since the 1970s. However, while this approach is effective in confined populations like Hasidic or Orthodox Jews, it may not be as effective in the general population. Ultrasound imaging uses sound waves to provide a picture of the fetus and its environment. The detailed images allow for the assessment of fetal age and the identification of the fetus's sex by 16 to 20 weeks. Ultrasound can also determine if there is more than one fetus. While not all potential problems are detectable with ultrasound, it can reveal some disorders, including abnormal head growth, defects of the heart, bladder, and kidneys, some chromosomal abnormalities, and neural tube defects. In Canada, women typically undergo 2 ultrasounds during pregnancy, one in the first trimester and another in the second one. For women expecting a geriatric pregnancy, this is when the mother's age is over 35. Additional ultrasounds are usually prescribed to monitor the health of both the mother and the baby more closely. One of the most valuable tools we have for assessment is amniocentesis. This procedure allows us to collect samples of both the amniotic fluid and the fetal cells within it. To do this, a needle is gently passed through the mother's abdomen into the amniotic cavity to gather the fluid. By analyzing this fluid, we can uncover various abnormalities. For example, the fetus produces a substance called alpha fetoprotein, AFP, which circulates in the amniotic fluid. When there is abnormally high levels of AFP, it can indicate certain types of damage to the brain, central nervous system, liver, or kidneys. Moreover, chromosomal analysis of fetal cells can detect several issues, such as Down syndrome. Thanks to advancements from the Human Genome Project, the list of detectable diseases has expanded significantly in recent years. We can now test fetal cells for many genetic defects, including achondroplasia, cystic fibrosis, Duchenne muscular dystrophy, sickle cell anemia, Tay Sachs, and more. While amniocentesis is typically performed after the 14th week of pregnancy, chorionic villus sampling (CVS) can provide valuable information about the fetus several weeks earlier. In this procedure, cells are collected from the chorion, which is part of the placenta. A small tube is gently inserted through either the mother's abdomen or cervix to reach the fetal placenta and collect a sample of fetal cells. These cells can reveal large-scale chromosomal defects as well as more minor DNA defects. CVS can be performed as early as 10 weeks into the pregnancy. It's important to note that both amniocentesis and CVS carry a slight risk of miscarriage, ranging from 1 to 2%. Fetoscopy is a surgical procedure performed during pregnancy that allows physicians to view the fetus in utero. In this procedure, a fiber optic endoscope is gently inserted into the uterus through either the abdomen or the cervix. Fetoscopy is being used to diagnose conditions such as hemophilia, Tay Sachs disease, Weber-Cochran syndrome, and spina bifida. Additionally, fetoscopy can be used to treat conditions like twin-to-twin transfusion syndrome and amniotic band syndrome. However, it's important to note that fetoscopy carries some risk, including fetal loss or preterm delivery. In vitro screening is utilized during in vitro fertilization, where egg cells are collected from the mother and fertilized in a petri dish. When the embryos reach the 6 to 10 cell stage, which is about 3 days post-fertilization, 1 or 2 cells are removed from each embryo. These cells can be then used to determine the sex of the embryo and within a few hours check the DNA for any suspected abnormalities. In vitro screening techniques are rarely used due to their high cost. They may be recommended for parents who are carriers of a genetic or chromosomal disorder, mothers with a history of unexplained miscarriages, or those outside the optimal childbearing age range. Medical therapy is currently the most widely available method for prenatal care. For example, providing extra vitamins to the mother can address deficits caused by inborn errors of metabolism in the fetus. Other medical interventions may involve treating illnesses in the mother to benefit the fetus. For example, drug treatment of pregnant women with HIV has significantly reduced the incidence of babies born with the virus. Fetal surgery is another option for addressing serious prenatal issues. Physicians can now perform surgery on fetuses to address a variety of life-threatening or severely damaging conditions, if not corrected early in development. These conditions include blockage of the urinary tract, congenital diaphragmatic hernia, when the diaphragm doesn't fully form, allowing organs to enter the chest cavity and affect lung growth, spina bifida, and other neurotube defects.